Hello and welcome to B&B Care Services. My name is Lynette Bragg. B&B Care Services home office is in Springfield, Georgia, which is a little north of Savannah area. We do cover the majority of the state of Georgia with many of the supports that we do offer. We are one of the best kept secrets on Main Street in Springfield because people just really do not know what our staff of close to 100 people provide to individuals all across the state. And we started this agency over 20 years ago based on a huge need that we as a family had. We had a son that had significant disabilities, and we needed just a little bit of help to be able to maintain our son within the family unit and at home. And we were able to just sit back and think about how could we build an agency that would be primarily designed to help families keep their family members at home. Again, people just need a little bit of help sometime in order to live, learn, work, and play in the community they want to be in. And we were very fortunate to be able to start this company named B&B Care Services. We had two sons, one with significant disabilities and the other one with significant abilities. Our younger son, Matthew, encouraged us to open the business to have as a means of supporting his brother, but also as a means of having a business that the business itself would support his brother throughout his lifespan. Our agency has been in business, as I said, for over 20 years with the primary focus of helping people live, learn, work, and play in the community. And every program that we offer fits into one of those categories. And we invite you to listen to different members of our team talk about these different programs. But please visit our website, click on there, contact us. Please schedule a meeting. Please look at the different ways that we help people. You will hear about programs that help people provide family support for individuals with developmental disabilities and autism. You will hear about programs that help people stay in the community and age in place as they need just a little bit of help to be able to stay home, stay with their family and friends in the community. You will also hear about programs that allow people that currently live in nursing facilities to be able to get supports to move out of those facilities back into their home, their own apartment, or into the community they wish to live in. So please sit back and enjoy. You will also hear about supported employment. We believe in wealth, not poverty. We believe that poverty is the number one disability that everyone faces in this country. And with that, we believe in helping people to get on a career path, help people have business ownerships, and have people have opportunities for wealth and not just rely on the government for the assistance that they may need. So thank you again for visiting B&B Care Services and learning a little bit more about what we do at B&B Care Services. The company is a vehicle that is used to help people obtain the services that they need, and our staff, our premier staff, seasoned premier staff, are working with you and on your behalf every day to help you live, learn, work, and play in your community.
Hi, I'm Valerie Everett, and I am the program manager for Options Counseling Services, the Nursing Home Transition Program, and the Community Transition Program, also known as Money Follows the Person, for B&B Care Services. There are 12 area agencies on aging for the state of Georgia, as well as various centers for independent living throughout the state of Georgia. B&B Care Services is contracted by Coastal and the Heart of Georgia Area Agency on Aging to provide options counseling services and the other transition programs. Options Counseling Services is a very unique service. It is funded through Georgia's Division of Aging Services, and it is designed to help individuals who are in long-term care facilities or other institutional settings return back to the community. Options counselors help individuals explore their options. They discuss Medicaid programs, non-Medicaid programs, and private pay options to help identify their barriers and their needs so that they can live, learn, work, and play in the community of their choice. If you or a loved one is interested in returning back to the community, anyone can make an Options Counseling referral. Please contact your local area agency on aging or our experienced and certified options counselors here at B&B Care Services. They will be happy to assist you. They will complete the necessary assessments to determine if you are eligible, and they will also be able to help make referrals for services that you need in order to return home. The Nursing Home Transition Program is funded through Georgia's Division of Aging Services. The program is designed to help individuals who are in long-term care facilities for short-term rehabilitation to return back to the community and to their home. The criteria for the Nursing Home Transition Program is a 20 consecutive day stay in the facility. Hospital admission stays can be included in the 20 consecutive day stay. Other criteria for Nursing Home Transition Program includes 55 years of age, proof of citizenship. There are no housing or financial restrictions. There is an income requirement, and the individual must meet level of impairment. A few of the services that are provided through the Nursing Home Transition Program include assistance with a security deposit, a utility deposit, household goods, furnishings, medical equipment, medical supplies, environmental modifications, and more. The Community Transition Program, also known as Money Follows the Person, is a grant program provided by the Centers for Medicare and Medicaid, and it is implemented by Georgia's Department of Community Health. The eligibility requirements for the Community Transition Program are a 60 consecutive day stay in a skilled long-term care nursing facility. Hospital stays do count towards the 60 consecutive day stay. Individuals will also need to be a recipient of Nursing Home Medicaid. They will also need to be a recipient of Georgia's Medicaid waiver. Individuals interested in the Community Transition Program will need qualified housing. This includes your own home, home of a family member, a rented apartment, or a personal care home that's 4 beds or less. If you are interested in renting an apartment, our transition coordinators and our options counselors are ready to assist you. We can help with obtaining the vital documentation that's needed in order to apply and be approved for an apartment. Services included in the Community Transition Program include, but are not limited to, assistance with a security deposit and first month's rent, assistance with utility deposits, household furnishings, household goods, groceries, medical equipment, medical supplies, and environmental modifications. B&B Care Services prides itself in person-centered services so that you can live, learn, work, and play in the community of your choice. If you are interested in our Options Counseling Services, our Nursing Home Transition Program, or our Community Transition Program, please visit our website at www.bnbcareservices.com.
Hello, my name is Pauline Shaw. I work with B&B Care Services as a Family Support Program Manager. Family Support Program is a program funded by the Department of Behavioral Health and Developmental Disabilities that gets funding from the state. It is a non-entitlement program for children ages 3 and up, and there's no age limit. The program allows up to $3,000 per fiscal year for services and goods that may not be covered by insurance for those with intellectual developmental disabilities and or autism. We provide such things as community access, respite services for families. We also have recreational activities, could be anything from karate to a family membership to their local YMCA. Also transportation reimbursement for mileage beyond 25 miles from their home for any medical or therapy appointments that they may have. We do specialized clothing, specialized equipment, things that are not covered by insurance. Family Supports can help with those. Here at B&B, we provide the families with lots of resources where they can access other programs or other funding sources. because Family Supports is payer of last resort. So for that little bit of funding that they get, we want to make sure that they've tapped into every other resource so that that money that they get from DBHDD can then be used for what they can't get anywhere else. And that's just being smart fiscally with that little bit of funding. We work with other nonprofits to help find things for these individuals to do, and the importance, and educate them on the importance of being included, being a part of their community, and building that community and how to go about doing that. One thing that sets us apart here at B&B is our connectivity that we have with our individual families to know their needs and to help them navigate the system, because these families are overwhelmed, and so we want to be able to be that resource for them. We here at B&B pride ourselves in the fact that we are a premier agency that connects the families to the resources that they need. We don't enable our families, we empower them. Many of the families that are referred to us by the Department of Behavior Health and Developmental Disabilities are coming to us when they are in crisis or about to go in crisis. We work with those families to get them through those tough times, and then they can use the services to maintain their lifestyle and to have the best quality of life. B&B is one piece of the puzzle, and it's when we connect them to all the other pieces of the puzzle that you can truly see the beautiful picture that and quality of life that they can have. When a parent receives a diagnosis for their child, they oftentimes are not given a resource book or a handbook, so they don't know where to turn to, but they can turn to B&B Care Services Family Support Program, and we will help walk them through the resources from age 3, from when they're transitioning from Babies Can't Wait, to when they going into the school if they need assistance with an IEP and knowing their rights in the educational system, to when they're transitioning out of the school system. We want to ensure that those individuals are not graduating to the couch, that they are graduating into a life that is full of friendships, relationships, and getting what they need in order to be a part of their community. By partnering with local businesses within 109 counties in the state of Georgia, we're able to help families increase the inclusion that they feel in their community and give them a better quality of life, because the quality of life is measured in smiles. B&B also works with our families to ensure that the Department of Behavior Health and Developmental Disability understands their needs, and we help advocate when it's time to bridge them over for a NOW-COMP waiver or even one of the other Medicaid waivers. To find out more about Family Supports, just go to our website at B&B Care Services, click on Family Supports, and find out how you can apply for these services and come be a part of the B&B family.
My name is Brittany Stout. I am employed here at B&B Care Services. I work with the Elderly and Disabled Waiver Program. I am the team lead brokering specialist. There are 6 of us. We study the initial assessment that our nurses complete, and based off that assessment that the nurse does, we review that level of care and we broker out services based on our nurses' assessment, what they suggest the participant needs are. Some of the services that we broker are personal support services, where the nurse aides will come into the home and provide that care. We do home delivered meals. We can do up to 14 meals per week. We have an emergency button in case our participant has a fall. They need access to, a phone and they can't get up. They have that button. Skilled nursing for those who have more needs to be met than what a regular CNA can do with the nurse aid services. We have structured family care. That's one of our popular ones, where a caregiver who actually lives in the home can be a family member and be paid to give care to that family member. So that is just a little bit of the services that we do. So we work very closely with the providers that we broker services to. We work closely with the nurses and case managers to assure that the services that were approved by the state are being served by the provider in an efficient, appropriate manner. We work very closely with the providers that we broker services to assure that services are going smoothly and the needs are being met. We do have a rebrokering department For those participants who are not happy with the services, who would like a new provider, we do have a team set up for that to change providers if a participant is not pleased with the service that they're getting at the time. Our goal here at B&B, no matter what department we're in, is always to assure that our participant can live, learn, love, and play in the community of their choice. I have been here 3 years, and I was also born with disability. I have to work with them, and just not knowing that this platform was here. God set the way, and I found myself home here at B&B Care Services. So now I get to spread the word in our community, which I think is a very beautiful thing. One of my personal goals being here at B&B is just to make sure that other families and other individuals here in the community are aware of the platform that B&B has set here in our own community. That is one beautiful thing I love about B&B, being able to do that.
My name's Heather Smith, and I am the program manager here at B&B Care Services for our supported employment program. So the way I like to describe supported employment to anyone that asks me about it is explaining to them that we help people in our community find jobs just like you and I. I believe strongly that all skills are acquired, that none of us are born knowing how to do really anything, and someone just has to care enough to teach us, to help us be successful in whatever it is that we have an interest in. And so here at B&B, we take a very customized approach to that job search, and we help folks learn what their talents are, what their abilities are, and what their interests are. We help them learn what they don't like. And we really start there by discovering their personal genius. And that's a phrase that has been coined by Griffin and Hammis, but it's a course that we learned called ACRE. And it is the discovery process where we're learning about that person in depth. And so what we do is we interview the participants and we find out what they like, what they don't like, and then we go from there on our job hunt to start making relationships in our community with small businesses. So here at B&B, we work in our community, making partnerships with local businesses. That could be small businesses or large businesses, but we're looking for people that buy into the same thing that we do, people that believe in those abilities that people have that haven't been untapped yet. And we build partnerships with them, and we're looking for places that are gonna offer comparable pay, benefits, and long-term opportunities for people that are interested in getting in the workforce. Here at B&B Care Services in our supported employment program, we have several professional employment specialists, and they will go on the job site with the participants and they'll learn that job with them. They'll teach them different ways to do that job, and they'll also work on making it adaptive for the participants so they can do well at the job.
My name is Shelby Van Arsdale. I work at Effingham County Board of Commissioners. I do filing, sorting, scanning, and the water bills. I have been working there for 4 years. Started working at Project Search, and they taught me how to do some job skills, and then they helped me find a job after that year was up, and that's how I found this job at Effingham County Board of Commissioners. My job coach helped me with the basics of this job. She showed me how to do it. My job coach comes maybe twice a month. She asked me how it's going, what I've been doing, if I've been alright, and if I need anything. She helps me talk to my boss about new tasks. She helps me give me a new raise. My coworkers are like family to me. They're a bunch of mothers. When I come into work every day, I start to smile and I see them every day. If you're looking for a job in the community, B&B is the way to go.
Our role is to be there every step of the way. When they learn a new task, we learn it with them. If they get promoted, it's almost like we get promoted with them and we learn whatever new duties go with that job as well. We are there for the life of the job. Some people call it job maintenance. We just call it a relationship. If you're a small business or a local business to Effingham, Chatham, or Bullitt County, B&B Care Services wants to partner with you. And if you want to work with us and you have opportunities to help someone realize their skills and abilities, please contact us at our office at 912-754-0817. You can ask for Heather or anyone on the supported employment team, and you can also visit our website at www.bnbcare.com.
Hi, my name is Erin Caldwell. I'm a nurse with B&B Care Services. I represent our intake team and our reassessment team. So that means we work closely with our community and our aging individuals who are needing help and services in the home. So we go through a process of interviewing in which we paint a picture to see what your everyday life is like and see how we can assist you with those needs. Our intake team interviews people who are interested in services to help them with basic needs in the home. These needs could include things like bathing, dressing, getting to and from doctor's appointments, and even medication needs in terms of helping them with phone calls to the pharmacy or picking up meds. In order to accomplish this, we interview the people who are interested in the services. And then we develop an individualized care plan to help them get the personal services that they need. I am so very proud to be a part of this team and serving our community.
Hello and welcome to B&B Care Services. My name is Lynette Bragg. B&B Care Services home office is in Springfield, Georgia, which is a little north of Savannah area. We do cover the majority of the state of Georgia with many of the supports that we do offer. We are one of the best kept secrets on Main Street in Springfield because people just really do not know what our staff of close to 100 people provide to individuals all across the state. B&B Care Services itself was the brainchild of Matthew Bragg, and Matthew was a very young man who was well ahead of his time in his thought processes and things, but he truly encouraged us to begin this agency to help his brother and also to help his brother have an income that would support him the rest of his life. And Matthew, we always knew, would make sure his brother was cared for from the time he was a young toddler going around to as he got older, making sure his brother had what he needed, what he wanted, and that his brother had a lot of stuff to laugh at. Because life is measured in laughs and smiles, not in what task you can perform. And Matthew was so brilliant on knowing those things way before his time. Matthew was killed in an automobile accident down the road from our home his senior year in high school. And from there, we learned very quickly that we could not rely on Matthew to be Scott's support system or the eyeballs that would be needed to make sure Scott was cared for. My son had significant disabilities and required 24-hour supports, but between the family and the paid supports that we could get or that we could pay for ourselves, he was able to stay at home and lived his entire life. In fact, he was able to pass away in his own home, and that in itself is a real privilege in this country to be surrounded by people that you love at that time of your life. So I think we really have evolved into an agency that was initiated on personal need and family need, but we look around and there are other families who need just a little bit of help, who may be going through a crisis, who may be trying to just survive the day-to-day of providing supports to their loved ones who are aging, to their loved ones who have disabilities. And that made us start working with families even more on developing long-term plans. What are your plans? How is your loved one going to be living if you are not there to oversee it or to pay for it? So we have evolved over the years to working individually with families on their long-term care needs. I think all of these things come together, and when I look at the future of B&B, I look at the tremendous staff that God has placed us with that work with the company, using the company as only the vehicle to get things done to help people with. This is not about the company. This is about the staff that work here being committed to working with individuals in helping them be in the community of their choice and get the supports that they need. We have highly qualified, seasoned staff that truly know resources in Georgia. We work very hard at having our staff be spokespersons for people with disabilities and those that are aging that cannot speak for themselves, but to bring those to the forefront for the state agencies that are charged with supporting people, and also the legislators that do put forth bills and funding for these particular programs to help people stay at home. So thank you again for visiting B&B Care Services and learning a little bit more about what we do at B&B Care Services. The company is a vehicle that is used to help people obtain the services that they need, and our staff, our premier staff, seasoned premier staff, are working with you and on your behalf every day to help you live, learn, work, and play in your community.